Good evening, everybody. Welcome to the Baby Bunting live sessions, Series 2, Episode 17. Tonight we're going to be discussing everything to do with your amazing newborn. We have Belinda Joyce along. Welcome, Belinda. Belinda is a midwife, maternal and child health nurse, and also the author of Surviving and Enjoying Your Baby. We're going to be covering everything newborn, so I'll just pass over to Belinda. What we're going to do, Belinda, is talk about the senses for the newborns. So what senses do the babies have?
Yeah, look, if we look at what a newborn baby can see, they can already see, even at straight after birth, between 20 and 40 centimetres, so around about that level that we often carry or hold a newborn baby at, which is pretty amazing. And their favourite thing to look at is their parents' faces. They absolutely love looking at faces, and if the faces are smiling and talking and getting that sort of eye contact, that's even better. They absolutely love it.
So besides us, what else do they like to look at?
Yeah, they really enjoy looking at patterns, sort of high contrast patterns, so black, white and red they really like. So you'll often see newborn toys and books and things with those colours and, you know, stripes and zigzags and spots and things like that on it. They love that.
Okay. So is it okay for babies' eyes, for one going that way and one going that way? Is that normal and okay?
Yeah, completely normal, although it really worries many parents. So if your baby's eyes can track together and look around occasionally, that's really important. But then they get worn out and tired and their eyes do go in different directions, and it is a little bit worrying, but completely normal.
Okay, great. So what about hearing? What do newborns hear?
Yeah, so babies are already hearing even when they're in utero, so they know their parents' voices, and after they're born they will turn to voices in general, but to their parents' voices even more. And they'll often, if they hear a bell ring or another noise, they'll often, quite slowly, but they will turn to look to see what that was that they heard.
Okay, so what do they like to listen to?
They love listening again to their parents' voices. So parents are their favourite toy.
Yeah.
So they love listening to their voices, and they love listening to music and singing. And I know many parents don't really like singing or don't like the sound of their own voice, but your baby will love the sound of your voice. And, you know, just singing some nursery rhymes and things, really, it will really enthrall them.
Until they're older and then they say,
That's
shut it
correct.
down, Mum and Dad. So what about their sense of touch?
Yeah, babies really love to be held and touched, and skin-to-skin contact is even better. So if a mum's breastfeeding, they'll have lots of skin-to-skin contact, but parents, you know, partners can also do skin-to-skin contact as well. And there's some really great little carriers that you can put a baby in where they are right onto your skin rather than having fabric in between, and they love it. They really, really love it. So and also showering with your baby is another opportunity for some skin-to-skin time. And we know that special, you know, premature babies in the special care nurseries, we've done lots of research and found that kangaroo care, which really is just skin-to-skin contact, we find that these babies grow faster and are happier and more settled. Because touch and that sensation of being loved is really, really important.
Okay.
Yeah.
So are the little guys too young to be massaged?
No, never too young to be massaged.
Or too old?
No, that's true. I actually take that back. A very premature baby who's in hospital would be probably too young, but be guided by the people caring for your baby. But once they're home, they're not too young to be massaged. So some gentle massage. You can use a little bit of baby massage oil, but do just be careful and test that on a small patch of their skin maybe the day before, and just check they don't have any reaction. But from then on, that can really enhance the lovely feelings of massage, and it can be a nice bedtime routine. And it's important to find good times to do massage too. So if your baby's really unsettled, it might not be the time to start a massage. Even if you think it might help them, chances are they won't like it if they're already crying. So move on and do it at another time. And you can do some baby massage classes, or just do some unstructured sort of stuff too, and that works as well.
Okay. Moving on to reflexes. What sort of reflexes are babies born with?
Yeah, it's amazing, all these primitive reflexes that nearly all babies are born with. They're really to protect them and keep them alive, and your midwife or doctor will be checking for these soon after your baby's born, and then in the early weeks and months as well.
Okay. So what is a searching reflex?
Yeah, so the searching reflex is to help a baby be fed, really. So a newborn baby, if you touch their cheek, they will turn their head that way and start opening their mouth and looking for a nipple, really, to feed. And then, of course, that's also stimulating the suck reflex, which anything that goes in their mouth and touches the roof of the mouth, so a dummy, a nipple, a teat on a bottle, or your finger, will get them to suck as well. So that's obviously a really important reflex for them to have to feed and grow.
Survive, basically, as well.
Yeah.
So the next one is a palm or a grasp reflex.
Yeah, so that's the reflex when a baby has their hand open and you put a finger in, they will actually grasp that finger quite tightly. And again, it's just important to know that they do that.
Yep.
Yep.
What about the startle reflex?
Oh, the startle reflex is a good one. So a little baby, when they get startled, so if they were put down very quickly, their arms will come up and they do this kind of a shocked thing. And it's
Like when you get your power bill, that sort of...
a little bit different to that. It's also the reason why we wrap babies, so that they can sleep without getting that startle reflex happening all throughout sleep. And again, just important to know that your baby does it. It will gradually reduce over those early months.
Oh. Yeah. This one sounds interesting for an amazing newborn, but a stepping reflex.
A stepping reflex. So newborn babies actually can take steps, and so if you hold them up, and obviously this is baby Gary, and I wouldn't hold a real newborn
advanced.
quite like this, but if you touch their feet on a mat or on the floor, they will actually take steps like this. And again, it's something we will always check. And most parents are pretty interested in seeing that they can do that. It's pretty amazing.
The other one which is interesting to me is a Babinski reflex.
The Babinski
Sounds
reflex.
like a Polish hockey player or something like that.
It does. All we do is just stroke the foot, and their toes will actually splay out like this and pull back. Again, some of the reflexes are important, and some of them now don't have a really big important need, but we still want to check that they have those reflexes. So, yeah.
Okay. Next one is, what about milestones for babies? What sort of milestones should they be ticking off?
Yeah, so in those early months, I guess the first ones we're looking for is that your baby gives you eye contact, and good eye contact, and they will start to communicate with you. So having a little chatter in their own baby voice, and sometimes that can actually sound like a little animal noises. And so they'll have a little chat to you, and then they'll stop. And that's when we chat back to them, and they stop and listen, and then we pause, and then they start again. And newborn babies are really good at doing that, which is pretty amazing, because that's communication started from birth. They will also often copy you poking your tongue out, which is a bit of fun, and it should just increase as the early weeks go by. And most newborns are smiling by 6 weeks of age, which always gives parents a real, I guess it's just really exciting. And newborn babies are a lot of hard work as well, so having those smiles really starts to feel like you're doing the right thing, you're being rewarded for all of that hard work. The other one, I guess, that's important is if your baby has some tummy time, which is really important for them, that by 4 weeks they are able to sort of lift their head up and turn it the other way. Many babies will actually do that from birth, and they'll continue to be able to do that as long as they're having lots of tummy time to practice. And then by 8 weeks, we want them to lift their head up and actually get their chin right off the mat for a good few seconds as well. And again, they'll only do that with practice. So it's really good to give your baby lots of tummy time.
Okay, thank you. So many babies are born in the fetal position, almost like in a ball.
Yes.
Is this normal, and
Yeah.
how should that be addressed?
So before they're born, if you think about where they've come from, they've been in that fetal position for many months and they haven't been able to stretch their limbs out. So after they're born, they're still often quite tight. But the babies that are even more tight are the babies that are breech. And some babies are even frank breech, where their legs are actually all the way up, and their legs are actually longer than this. They come up higher. So you can imagine those babies, after they're born, they're not really wanting to be stretched out, and you just need to really gently massage and gently move their legs and arms out as you can, and be guided by your midwives and doctors at the hospital as well with what to do. And sometimes you do need to see a paediatric physio just to learn some specific exercises for your baby to help them really stretch out and get that full range of movement.
So Gary's not anatomically correct, is that what you're
I don't think so.
You're out of a job, Gary. Just joking. A really important one for all parents of newborns. What can we expect in the way of sleep with an amazing newborn child?
So even though newborn babies sleep for about 16 to 20 hours a day, it's very broken up. So it sounds like a lot of sleep, but in actual fact, the parents usually aren't getting a lot of sleep. And that broken up and needing to be fed, because their tummies are so small, they really do need to be fed very often. They digest their milk so quickly that they then start looking for more. So if your newborn's been awake for about an hour to an hour and a half, they're usually showing plenty of tired signs, and it's time to probably wrap them back up or put them in their swaddle and back into the cot for a nap or for a sleep, and just leave them and see if they will just settle. If this is done often from early on, lots of babies will settle without a lot of help if you catch them at the right time. But obviously this isn't always going to work, so some settling techniques and things will come into play, but that's a whole nother episode.
So no iPads with YouTube or anything like that? We don't?
Not at all.
Okay.
No.
The next one to discuss, some babies are born with swollen genitals.
Yes.
Is that normal?
Very normal. Can be quite alarming. So little girls and boy babies can have quite swollen breast tissue, and they can even secrete or leak a little bit of milk. And parents are often quite shocked if it's a little boy baby leaking milk, but again, completely normal. Little girl babies can get just a small mini period and pass a little bit of blood and mucus from the vagina. Again, that can be a bit shocking, but is completely normal. And little boy babies, they often have extremely swollen testes, and that's very normal. They'll also often get little erections just before they wee. And if the nappy's off, you can imagine that's quite messy. But again, really normal. Everything should settle down in those early weeks to months, and be guided by your health professionals.
Okay, all right. Next topic is birthmarks. Normal?
Very normal. Many babies have birthmarks, and there's lots of different types of birthmarks. So most are present at birth, as you would expect, but strawberry birthmarks actually come up a couple of days after birth. Sometimes it's after you've gone home or nobody's really noticed it, and you get home and you think, oh, where did that come from? So just check with your health professional. Most cases there's nothing that needs to be done, but in some cases, particularly if the birthmark's on the face, there might be some treatment required. So do just check if anything needs to be done. Some of the birthmarks, like stalk bites, which are often around the nape of the neck and around the eyebrows and eyelids, those will just go away by themselves by around 12 months. And then other birthmarks are permanent as well. So just make sure you know what sort of birthmark they think your baby has, so that you'll know whether any treatment's necessary or not.
Okay. Sorry guys, what I will mention is, I forgot to mention before, if you've got any questions on what we've discussed so far, or what we do discuss, please whack them in the comments section and we'll get to them as soon as we can. The next one is facial and back hair on babies.
Yeah, it's really common.
Can sometimes be full on.
Yeah, it can. So when your newborn is born and they have lots of hair on them, it can be a little bit of a shock. But again, it's really normal. So babies are covered with that waxy vernix, sort of creamy substance that helps keep their skin nice while they're in the amniotic fluid in utero. So the hair, it's called lanugo, and it actually helps hold the waxy substance onto the skin. So it's got a really important job in those last few weeks as the baby's moving around and they're running out of space. They actually rub that hair and the vernix off their body more and more. And some babies seem to rub it all off, and other babies have lots still when they're born. And it doesn't really mean anything, and it will come off in the early weeks usually. Often the hair is along the ear ridges, down on the forehead, around the sides, and on the upper arms, the upper back and lower back. And I think parents, especially with little girl babies, get really worried that they've just got far too much hair, but it's absolutely fine and very normal.
Okay, thank you. What about the eye colour, Belinda? Does that, when a parent's going to know the eye colour that it's going to stay at?
Yeah, so the eye colour your baby's born with will generally change. Many babies are born with blue eyes, although quite a few have that really steely dark sort of eyes as well. The most common eye colour for humans to end up with is brown. So if you're going to end up with brown eyes, chances are you'll be born with quite dark eyes rather than the light blue. But you really can't tell. And there's a lot of change in eye colour between 3 and 6 months of age, but really all the way up until 12 months they can keep changing. And even after that they can change a little bit. So the really bright blue eyes will often get less bright and a bit dull or a bit darker.
Yeah.
So it is hard to tell.
Okay. So moving on to hair, same subject, colour of the hair.
Yeah, so
newborn.
Many newborns, as we know, they're born with no hair, so we really don't have any clues of what their hair's going to be like. But even the babies born with full heads of hair, sometimes they lose all of that hair, and the hair that grows back is a different colour or quite, a really different texture. So it might have been that really soft newborn hair, and the hair that comes back is more coarse or wavy or curly, and a totally different colour. So again, that can just sort of keep changing, and it's kind of a lifelong progression as well. So hair colour can keep changing. It can even change in texture and colour in the teenage years, and then as we know, as we get older, it continues to change.
Sometimes disappears.
It does
For some people.
Yep.
We've been through pretty much everything to do with newborn that we were going to discuss. Is there any further advice you'd like to give the guys watching this?
Yeah, just as amazing as it is, looking after a newborn's also a lot of work. Try to really enjoy them in those early months, because you probably hear people say to you, it goes so fast and your baby will grow up, and it really does go so fast. So really enjoy them while they're in that newborn period. And if your baby doesn't seem to be developing at the same rate as other babies of their age, or if the sort of things I was talking about aren't happening with your baby, please see your health professional, so your GP, your maternal child health nurse, and just check in and check that everything is okay. In most cases, you'll be reassured to know that it is.
Okay, thank you. We have a question.
Linda has asked if the searching reflex, is that a sign that they're hungry, or not necessarily?
Not necessarily. In fact, that's a really good question. I meant to cover that. So because it's a reflex, it's a bit like the sucking reflex. If anything touches the roof of your baby's mouth, they will suck, whether they're hungry or not. The searching reflex is the same. So if something touches their cheek, they will turn their head to it, even if they've got a big full belly of milk. So it's not, a great indicator of hunger. Great question.
Ashish would like to know if you have any things to consider while giving a newborn a bath.
Yeah, just really important the way you hold them. And there is a series, an episode that we did on bathing that would be worth going back to and having a look. I think the most important thing with a newborn bath is that it's not too hot, and to cradle the baby in a safe way. So I think this holds quite good where you actually cradle the baby, but your hand goes around, that your fingers go around their upper arm and your other arm's like this. So, and then you plunge them into the bath and they can't fall under the water because they're supported by your arm, because they get a bit slippery in the water. But go back and have a look at that other episode too.
Titu has said that their baby is 1 month and 6 days old. She does not sleep well. Sometimes she sleeps 1 to 2 hours continuously, but most of the time she'll only sleep 10 to 15 minutes and wake up and cry. Is there anything she can do to assist the baby to get more tired?
I guess, is the baby having a bit of playtime as well? It's still very young, so congratulations on your baby, by the way. But your baby's very young, so they often, they sort of go from that period of always being wrapped up and always in your arms or feeding, and then they get that little bit older and they need some time to have a kick around and use some of their energy up. So you might be able to, if they wake up and you feed them, then do a nappy change and give your baby a bit of time, perhaps on a little play mat on the floor to kick around, a bit of tummy time, and start looking for tired signs before you wrap them up and pop them back to bed. So they're, getting a little bit grizzly and not being as happy, maybe arching the back, rubbing the eyes, crying, those kind of things, and then look to pop them to bed.
Okay. Thanks very much for watching tonight. Thank you, Belinda, for your time once again. If you'd like to see more of Belinda, you can access her website and also her book, Survive and Enjoy Your Baby, which we will add the link to this post. Thank you very much for tonight and have a great night. Thank you.